I'm going to talk to you about other things like camouflaging products and hair pieces, because what you need to know is there are other things to consider when the patient showed up to your office for hair transplant. I have nothing to disclose. So what are those options? This is what sometimes you're going to have a patient come in and you're going to see it's like maybe too much, the hair loss advanced too much, so what can you really do for this patient? Some people will have a hair piece come to you and say, hey, I want to get out of a hair piece, can you do something for me? So in order to evaluate what is available, we are going to talk about what is on the market. In the past, the hair pieces look ugly. This is what a hair piece looked in the past. This is what a hair piece looks today. They are made of mesh base, so you can see scalp through. They have natural hair woven through, so you can see the hairline. In the past, we couldn't, hair pieces were not nicely done, so there will be a lot of actors that wear hair piece that you wouldn't even know because they are done properly. So hair piece is not something to disregard because some patients are going to be a good candidate for hair piece. The pros and cons in having a hair piece are that if hair piece is attached to a hairline that still has good temporal points, then it can match well. But if the patient has receded temporal points, you're going to see, like here, it looks like unnatural pattern. So someone who has a flat temporal points usually has advanced hairline on the top. So this would be a natural part of the hairpiece. In someone who is Norwood 7, limited donor area, they want full head of hair, hairpiece is a choice. The hair pieces are usually, there's a specialty hair salons that they do them. They're custom made, so they match the person's head. They can have different bases, as I mentioned earlier, so they can swim with these hair pieces. They usually order 2 to 3 a year, and so they would go to the hair salon, and over the period of a year, they would rotate those hair pieces so they always look nice and natural. The hair piece is usually attached with a glue to the scalp. And if there's any hair, usually it's better attached when there's some hairs. They don't just attach to the bare scalp. So if there's some hairs, they're going to shave around, attach the glue. As hair grows, the glue loosens, and the patient, a person needs to go back to redo the attachment of the hair piece. So what I'm trying to say is, they can look very natural, but at the same time, there's some maintenance to be done to it. It should not be disregarded as an option for a patient, because if someone comes to your office, you can say, hey, you can shave your head or you can have a hair piece, but a hair transplant may not be an option because sometimes your donor area is so limited that you can't provide what they're desiring. So it's better doing nothing than doing something that is going to look not natural or disappointing to the patient. So the option with the hair system and hair transplant can be combined. You see how this is a comb over, this is a hair piece. This is, the person looks immediately much better. So it's not something to be disregarded. But it can be combined with hair transplant, and I'm going to explain that a little bit later. Camouflaging products, actually let me go back this second. Hair piece can be worn by a patient. So for example, someone who is advanced, has an advanced hair loss, they can wear hair piece, but then we can reconstruct the temporal points. You see, if this person had the temporal points reconstructed, it doesn't require a lot of donor hair, but then it would match well with a hair piece. So it can be combined with hair transplant. Camouflaging products have a purpose to decrease the contrast between the hair color and the scalp color. So the lighter the scalp, the darker the hair, the more see-through. So in some situations, we can do fibers, which are going to attach to, it's a keratin fiber attached to the hair shaft and creates the shadow. So the scalp is not as exposed. And then other products such as like a Dermatch goes straight to the scalp. So it covers the scalp to neutralize the color of the scalp and have it match with the hair. The idea is to decrease the contrast in hair color and the scalp color and creates more visual density. How are they complementary? I mentioned earlier in women. Women may have a hair loss pattern there, and then their donor area is not dense enough to do any transplant. So they can wear a hairpiece that their hairpieces are usually thicker. Men can have a hairpiece with a naturally looking hairline, but the overall hairpiece is going to be thinner. So then that blends and looks natural. But if the woman wants to have a thick hairpiece, you can't go from thick hairpiece to the fine hairline. So what they do, they even have sometimes fine mesh, or she would come and have a hair transplant done, and then you do a nice hairline, but you do a straight hairline, maybe 1 finger width, with feathering, create a space, and then she wears a hairpiece behind it, okay? One thing I forgot to mention is if a man is losing temporal points, a hairpiece cannot be restored to create the temporal points. Otherwise, it looks like a full cap. So this is why they can only attach to the top, the back, but the hairpiece cannot be made to restore the temporal points. That's where the hair transplant comes into place. This is a patient of ours. This is him with hairpiece. He had to style hair forward to kind of camouflage a little bit the hairline and the temporal points. And this is with restored temporal points, and this is still a hairpiece. Now he came in and parted, and it looks more natural. So you would not tell that this is a hairpiece, but it blends better once you have that aesthetic eye to combine what is possible. So how does it complement? The camouflaging products can complement thinning hair in women. Fibers are great. They're easily applicable, but they're temporary. So at the end of the day, when they wash their hair, the fibers are washed off. And then they can be also like that camouflaging scar. Usually, if it's applied directly on the scar, can camouflage. If a patient is wearing a hair system and wants to transition out of hair system, has a hair transplant. So what you need to know is that it takes about 12 months for them to transition because they're used to looking certain way, and so until they kind of get used to new hair, it may take time to transition out. After the hair transplant, they have to make sure that before they put the hair piece back on, so after the hair transplant for 14 days, they should not wear the hair system back. Sometimes we can say 7 days if it's really urgent, but we usually push to 14 days, no hair system after the hair transplant. So what they do is they're going to transition from more permanent bond to something that is temporary. So they are going to ask their hair stylist to put clips, which means they can remove it, put it on and off. The second thing they're going to do, they have to wash it thoroughly. And then, so this is what I say, 2 weeks, tape in the front and clips. Make sure to explain to your patient if they tape onto the transplanted hairs, once the hair transplanted, the hair starts growing and they keep taping it, they can keep removing the transplanted hair and kill the grafts not kill, but it damage the results. So for 2 weeks, no hair system, wash hair system before putting it back on and changing from tape to clip. And then after that, they can, once the scabs are gone, everything is healed well, they can go back to their hair system with making them aware. Then once the hair starts growing back, they have to be aware where they're putting hair system so they don't pull the transplanted hair out. Complications, if they put the hair system that is dirty, they can cause infection. If they put the hair system on and they are not careful on how they wash the area, they put it sooner, they can also cause the infection. And as I mentioned earlier, suboptimal growth is the complication. In using camouflaging products, post-operative shedding is a great situation to use the camouflaging products. So not only that you can give to patients who cannot be a good candidate for hair transplant, you can also recommend the camouflaging products to almost all of your hair transplant patients who have some hair, because after hair transplant they can go through post-operative shedding that could be very scary and concerning. So if you give them a temporary product, then they can be happy. They can use that product 5 to 7 days after the transplant. We usually say 7 days to be on the safer side. When the scabs are gone and everything is healed, they can do the camouflaging products. Make sure that they always wash it out well, and they always apply Rogaine first and then a camouflaging product. Among all the camouflaging products, for example, in our office we use Nanogen. There are several different brands. The most common or well-known is Topic. What we like about Nanogen, it comes in a container that polarizes the fibers, so the fibers stick to the hair versus clumping together. So that means when the person is, it's like, the way it applies like a shaking. So what I do in the office, I show them, I demonstrate, I move hair around and shake this fiber and attaches to hair. While I'm doing that, I show them that it did not stick to my hands, which means that they are more comfortable. You can touch hair. Otherwise, if they put a camouflaging product, they don't touch anything. It looks unnatural. So if you have a product that you can give them, they can live more easily with it, then it's a good product that helps them through the transition. And we bring that product from England. Another thing that can complement is scalp micropigmentation. Don't be cavalier about scalp micropigmentation. It's a fancy word for medical tattooing, but at the same time is something that cannot be learned and easily just done. The reason is pigment can shift. Pigment in scalp is different than skin. Scalp has more sebaceous glands, which will take the pigment and bleed it underneath the skin. So it doesn't, if someone who is doing well tattooing on the skin cannot necessarily do the tattoo for the scalp easily. Second thing, the pigment can change from black to blue. So you make black dots and patient comes back within a few weeks or few months and he has blue permanent dots in their head. So it's not something you can just easily pick up and do. But it could be a great adjacent to any treatment. And so it can camouflage the scars, and it can also recreate this look on someone who has limited donor hair. So today the shaving head is in vogue. So they can go and do scalp micropigmentation. It looks like shaved hair, but it's two-dimensional. So the moment the hair starts growing, it's growing longer than just shaved. It doesn't look natural. You have to explain that to your patients that that's an option, but they have to commit to the shaved head to the rest of their lives. I was supposed to do this fast. Am I fast enough? Okay. So think about there's other options than just hair transplant. I know you're a surgeon, so that's the tool you would like to use, but sometimes it can be combined, and sometimes it's better to recommend patient to do something else than to do limited hair transplant and then have an unhappy patient. And also it's something, a patient walks around with your results, your name, and it's not fun. I listened to Tina and she said, sometimes we make great difference to patient, we change their lives for the better, but sometimes we can change for worse if we don't do something right. So keep that in mind. So either sometimes an option is hairpiece, and sometimes it's a camouflaging product. Any questions?
Thank you very much.
You are.
It's very important to
We sell the pencil. So this actually
Yes.
take a picture. And then give me please.
Hey, you want me to take a picture?
Oh, okay. She's from Brazil.
Oh, okay. Oh, take a photo with it. You think it would be simple to explain this to us, but you want a picture of me and a horse? What? Oh, what? A horse from Brazil? What? Here, I'll go in this side. Okay. Here you go. He's not. Okay, they'll go. We're sorry.
Hey, can you take St.
You want to stand in
Louis?
front of the food?
Yeah.
Oh, yeah, that's a good idea.
So you two. I do that too. I have one over here. Has one.